Question 1. Which of the following is the most important step in preventing the spread of infection? Choices are wearing gloves at all times, washing hands frequently, using hand sanitizer exclusively, sterilizing all patient rooms. The correct answer is B. Frequent and proper hand hygiene is universally recognized as the single most effective way to prevent the spread of pathogens. Question 2. When entering a resident's room, a certified nursing assistant (CNA) should always do which of the following first? Choices are introduce themselves and state their purpose, knock on the door and wait for permission to enter, turn on the lights to ensure safety, check the resident's identification band. The correct answer is B. Knocking before entering respects the resident's privacy, dignity, and rights within their living space. Question 3. What is the normal range for an adult's resting heart rate? Choices are 40 to 60 beats per minute, 60 to 100 beats per minute, 80 to 120 beats per minute, 100 to 140 beats per minute. The correct answer is B. A normal resting heart rate for healthy adults typically ranges from 60 to 100 beats per minute. Question 4. To prevent pressure ulcers, a bedridden resident should be repositioned at least every. Choices are 30 minutes, 1 hour, 2 hours, 4 hours. The correct answer is C. Repositioning a bedbound resident at least every 2 hours helps relieve pressure and prevents the formation of pressure ulcers. Question 5. What is the primary role of a CNA when a resident is placed in physical restraints? Choices are checking the resident and the restraint at least every 15 minutes, keeping the resident sedated while restrained, leaving the resident alone to rest undisturbed, removing the restraint every 4 hours for exercise. The correct answer is A. CNAs must monitor restrained residents at least every 15 minutes to ensure their safety, comfort, and proper circulation. Question 6. When feeding a resident who has difficulty swallowing, dysphagia, the CNA should. Choices are feed them as quickly as possible, encourage them to drink thin liquids, position them in a high Fowler's position, encourage them to talk while eating. The correct answer is C. Positioning a resident in an upright high Fowler's position during meals minimizes the risk of choking and aspiration. Question 7. If a resident with dementia becomes agitated and aggressive, the CNA should. Choices are argue with the resident to correct them, use physical force to restrain them, speak in a calm, reassuring voice and give them space, ignore the resident until they calm down. The correct answer is C. Using a calm, non-threatening approach and speaking softly helps de-escalate agitation in residents with dementia. Question 8. When performing perineal care for a female resident, the CNA should always wipe. Choices are from back to front, from front to back, in a circular motion, side to side. The correct answer is B. Wiping from front to back prevents the spread of fecal bacteria to the urinary tract, reducing the risk of urinary tract infections. Question 9. When lifting a heavy object off the floor, the CNA should. Choices are bend at the waist and keep knees straight, keep feet close together and twist while lifting, bend at the knees and hips, keeping the back straight, hold the object as far away from the body as possible. The correct answer is C. Bending at the knees and hips utilizes the strong muscles of the legs and protects the back from injury. Question 10. What does the medical abbreviation NPO stand for? Choices are new patient only, normal pulse observed, nothing by mouth, no pain onset. The correct answer is C. The abbreviation NPO comes from the Latin phrase nil pros, which translates directly to nothing by mouth. Question 11. In the acronym RACE for fire safety, what does the R stand for? Choices are run, rescue, report, extinguish. The correct answer is B. In fire safety protocols, R stands for rescue or remove residents from immediate danger. Question 12. If a resident drinks 4 ounces of juice, how many milliliters, ml, should the CNA record? Choices are 30 milliliters, 60 milliliters, 120 milliliters, 240 milliliters. The correct answer is C. Since 1 fluid ounce is equal to 30 milliliters, 4 ounces of juice equals 120 milliliters. Question 13. If a CNA suspects that a resident is being abused, they must. Choices are: ignore it unless they have solid proof, confront the person suspected of abuse immediately, report the suspicions immediately to the supervising nurse, ask the resident's family if they noticed anything. The correct answer is C. CNAs are mandated reporters and must immediately report any suspected abuse to their direct supervisor or supervising nurse. Question 14. Which route for taking a temperature is considered the most accurate? Choices are axillary, oral, rectal, tympanic. The correct answer is C. The rectal route is considered the most accurate method for obtaining a core body temperature. Question 15. To communicate effectively with a resident who has hearing loss, the CNA should. Choices are: shout directly into the resident's ear, stand behind the resident while speaking, face the resident directly and speak clearly at a moderate pace, avoid communication unless absolutely necessary. The correct answer is C. Facing the resident directly allows them to see facial expressions and lip movements, while speaking clearly helps comprehension. Question 16. When assisting a resident with one-sided weakness to dress, the CNA should. Choices are: dress the unaffected side first, dress the affected side first, dress both sides simultaneously, ask the family to dress the resident. The correct answer is B. When dressing a resident with weakness, you should always dress the affected, weak, side first to prevent strain and injury. Question 17. When changing an occupied bed, the CNA should. Choices are: lower the side rails on both sides of the bed, raise the bed to a comfortable working height, keep the resident uncovered during the entire process, shake the clean linens to remove wrinkles. The correct answer is B. Raising the bed to a comfortable working level prevents back strain for the nursing assistant during bed changes. Question 18. What is the universal sign that a person is choking? Choices are: coughing loudly, pointing at the throat, clutching the throat with one or both hands, screaming for help. The correct answer is C. Clutching the throat with one or both hands is the universal physical sign of choking. Question 19. When caring for a resident with an indwelling urinary catheter, where should the drainage bag be secured? Choices are: on the bed frame, below the level of the bladder, on the side rail, above the level of the bladder, on the floor next to the bed, attached to the resident's four-pole. The correct answer is A. The urinary drainage bag must always be kept below the level of the bladder to prevent urine backflow, which can cause infection. Question 20. What is the most important intervention to prevent a resident from falling out of bed? Choices are: keeping the bed in its lowest position, keeping all 4 side rails raised at all times, tying the resident to the bed, leaving the room lights on all night. The correct answer is A. Keeping the bed in its lowest position minimizes the risk of serious injury if a resident attempts to get out of bed. Question 21. During range of motion (ROM) exercises, the term abduction means moving a body part. Choices are: toward the midline of the body, away from the midline of the body, in a circular motion, downward toward the ground. The correct answer is B. Abduction refers to moving a limb or body part away from the median plane or midline of the body. Question 22. What is the primary focus of palliative or hospice care? Choices are providing aggressive curative treatments, keeping the resident physically active, providing comfort, dignity, and pain management, performing diagnostic testing. The correct answer is C. Hospice and palliative care focus on maximizing comfort, managing pain, and preserving dignity for residents nearing the end of life. Question 23. When a resident has dry, fragile skin, the CNA should. Choices are bathe them with hot water and strong soap daily. Rub the skin vigorously with a towel after bathing. Apply lotion to the dry areas, excluding between the toes. Encourage them to stay out of bed as much as possible. The correct answer is C. Applying lotion helps moisturize fragile skin, but avoiding the areas between the toes is critical to prevent moisture buildup and fungal growth. Question 24. When collecting a 24-hour urine specimen, the CNA should. Choices are keep the container in a warm place. Discard the first voiding and collect all subsequent urine. Collect only the first morning urine. Ask the resident to strain all urine. The correct answer is B. For a 24-hour urine collection, the test begins by discarding the very first voiding and then collecting every drop of urine for the next 24 hours. Question 25. When performing post-mortem care, the CNA should place the body in which position? Choices are prone position, supine position with the head slightly elevated, lateral position on the right side, high Fowler's position. The correct answer is B. Placing the body in a supine position with the head slightly elevated prevents blood pooling in the face, which can cause discoloration. Question 26. Which PP should a CNA always wear when caring for a resident on contact precautions? Choices are mask and goggles, gown and gloves, N95 respirator only, surgical cap, and shoe covers. The correct answer is B. Contact precautions require healthcare workers to wear a gown and gloves to prevent the direct spread of pathogens. Question 27. What is the normal range of respirations for a healthy adult at rest? Choices are 8 to 12 breaths per minute, 12 to 20 breaths per minute, 20 to 30 breaths per minute, 30 to 40 breaths per minute. The correct answer is B. A normal resting respiratory rate for healthy adults typically ranges from 12 to 20 breaths per minute. Question 28. A localized area of intact skin with non-blanchable redness is classified as what stage of pressure ulcer? Choices are Stage 1, Stage 2, Stage 3, Stage 4. The correct answer is A. A Stage 1 pressure ulcer is characterized by intact skin with non-blanchable redness, usually over a bony prominence. Question 29. When assisting a resident to transfer using a transfer, gait, belt, the CNA should. Choices are grasp the belt from the back with an underhand grip, grasp the belt from the front with an overhand grip. Ask the resident to hold onto the CNA's neck. Leave the belt loose to avoid constricting the resident. The correct answer is A. Grasping the gait belt from the back or sides with an underhand grip provides the most secure and supportive hold during a transfer. Question 30. The first sound heard when measuring a resident's blood pressure represents the. Choices are diastolic pressure, systolic pressure, pulse deficit, mean arterial pressure. The correct answer is B. The systolic pressure is represented by the very first tapping sound heard when deflating the blood pressure cuff.